Hi, I'm Dr. Jim McDonald from the Rhode Island Department of Health. Today we're going to talk about contact tracing when it involves COVID-19. The disease is caused by the virus SARS-CoV-2. And we want to answer questions, and you should have questions. It's a new disease. We all have questions. And contact tracing isn't something that should be common to anyone. So let's just unpack it a little bit and talk about some other public health terms and try to make sense of this whole pandemic for us. So we're going to talk a little bit today about quarantine, talk about isolation, we're going to talk about contact tracing, and then we're going to talk about when you can go back to work. A key point though is that if you're sick, if you're symptomatic with any symptoms, you really can't go to work. That's just true for everybody right now. You can't go to work when you're sick. And you know, that's a new message. In the past, sometimes we'd have a cold, we'd feel a little bit under the weather, we'd just go to work. We can't do that anymore. That's actually dangerous right now. So that's something we have to change our behavior about right now. If you think you have symptoms of COVID-19, that can be something as simple as a runny nose, cough, sore throat, body aches, diarrhea. Some people have having lost the smell. That's a good reason to reach out to your personal physician and ask that question. And they can evaluate whether or not you should be evaluated for or even tested for COVID-19. And there are testing options. So if you think you need to be tested for COVID-19, the Department of Health website has information about how you can get a test done. Right now, that can be done a couple different ways. One, through your healthcare provider, where they can schedule you through their own office or at one of our National Guard sites, or you can go on yourself to the CVS.com website and schedule your own test if you have symptoms and meet their criteria. There's also something else you can do. We have a new app that just launched today called covidselfcheck.ri.gov. So one of the things you can do on this little website called covidselfcheck.ri.gov is actually assess yourself and see if you have symptoms of COVID-19. And it will actually walk you through a little algorithm and help you decide what you need to do next. Now, test results. If you do have a test done, healthcare is a little different. You know, normally we think of positive as, well, a good thing. That's why it's called positive, right? But in healthcare, when you have a positive test result, that means you have the disease. That's what positive means. You've tested positive for the disease. So you have a COVID-19 test and your doctor says you're positive, that means you're positive for the SARS-CoV-2 virus and you have COVID-19 disease. So this is where a negative, which we normally think is a bad thing, is actually a good thing. So not that we can root for a test result, because it really doesn't matter what you root for. It is what it is. But the bottom line is, negative is good news, positive, well, that just means you've got news that you've got COVID-19 disease here. When you really want to get your test results, though, you should be talking from your doctor. If you did go to the CVS website, you're going to get the result right there at the CVS testing site at Twin River. The CVS testing site at Twin River has the rapid Abbott ID Now test, so you get your result within 30 minutes. For some people, that's good. For other people, you go through your doctor, and your doctor will send the specimen to a lab, and that result may come back in a day or two. Just depends on how quick the lab is. Now, a couple things. If you do test positive for the COVID-19 disease, then that result from the laboratory is reported to the Department of Health. This is a reportable disease. What a reportable disease means is whatever lab found that result, they have to tell the Department of Health. So we find out about all positive results. So someone at the Department of Health who works for the Department of Health will then start doing case management and contact identification, and we start figuring out what to do about that positive result. So that's something that's different, because most times when you go to the doctor and you have a diagnosis, the Department of Health doesn't find out about that. But with COVID-19, because it's such a contagious disease, it's what's called a reportable disease. So we find out, and then we have to do something with that information. We have to do contact tracing, and we do that through what's called a case investigator. So a case investigator is someone who will reach out to you who has disease within 24 hours, and they'll start putting information into your little brain and help you understand what's going on with this, right? And they're going to talk to you about isolation. So isolation is one of those other concepts we need to use. We isolate when we're ill. And that's how I remember it, by the way. I in isolation, I in illness. And the point is, what the case investigator will tell you is you have to isolate and have to stay away from other people. That way you don't spread it. Because while you're symptomatic, you're very contagious. So it's important to remember to do that. And then the people who live in your home, even if they feel well, will be what's called quarantined. And that's another public health term that we didn't use very often before this pandemic, but now we use it all the time. Quarantine means even the people who are well need to be told they can't go out and do what they wanted to do. They have to stay at home. Now that's people who are within close contact of you. In other words, people who are in close contact with you are people who are within 6 feet of you for a prolonged period of time, like 15 minutes or so. So that's just an important way. Those are the people who are exposed to. People who live in your home, those are people who are contacts. So our contact investigator identifies those people for sure, because your family, you live together. They're going to have to be quarantined. And quarantine means you have to stay at home. A couple more things about this if you test positive. So if you test positive, it's important for you to let your supervisor know and the Human Resources Disability Management Unit know. Especially if you get your result directly from the CVS testing site. And part of why is that the Human Resources folks and your supervisor will work with you on options for teleworking or discharging time while you're out, so you know how to do that. So after the Rhode Island Department of Health speaks to the patient, the Rhode Island Department of Health then calls the patient's direct contacts and tell them they have been exposed to a positive case. Now, this is important. The name of the patient is never shared with the contacts because you have a right to privacy there, so we don't do that. And keep in mind, the people who we're going to call as contacts are people that you had direct exposure to 15 minutes within 6 feet. So if you stay more than 6 feet away from people, that's going to limit the number of people you have contacts to. That's part of why the social distancing, staying more than 6 feet away, is so important all the time here. So when a patient identifies a workplace exposure, the Rhode Island Department of Health also notifies the employer. So the employer knows about this result as well. Now, if the patient is a state of Rhode Island employee, the Rhode Island Department of Health leadership is notified to facilitate interagency coordination with the state's Division of Human Resources. Now, if we found a cluster of cases means more than 2 or 3 cases in the same workspace, or there's a number of exposed contacts in the same space at a specific location, then additional infection prevention guidance is discussed and then disseminated to the other employees. Once all the patient's direct contacts are identified, they are quarantined for 14 days, so 2 weeks, and then enrolled in what's called the Test Illness Monitoring System, or TIMS. So they receive a text message every day during their 14-day period of quarantine, and it's going to ask them to monitor their symptoms. Now, if someone develops symptoms during their quarantine period, they should call the Rhode Island Department of Health at 222-2577. They're going to talk to one of the Rhode Island Department of Health specially trained staff who can assess whether you need to have a COVID-19 test. Then you can also contact your primary care physician or healthcare provider for a telehealth visit, and then you can see if you can have a visit that way and then get guidance that way as well. At the end of the quarantine period, end of that 14-day period, the contacts are notified by quarantine over email, text, or phone that their quarantine period is over. So one more thing I want to talk about is ending your period of isolation and going back to work. So people with COVID-19 who have had to stay at home can stop home isolation and safely go back to work after all these conditions are met. So just please listen closely to this. You've had no symptoms of it all, including no fever for at least 72 hours. That is 3 full days, and you haven't taken any medicine like Tylenol or Motrin to stop your fever. And it's been at least 7 days since your first symptoms appeared. So it obviously could be longer than 7 days, but the kind of key thing there is you have to have all your symptoms resolved. Once those conditions are met, you can safely return to work and not worry about spreading your disease to anyone else. At that point, we're really happy for you because you're considered recovered, and that's important. So there's some final messages I have for everybody here, and it's important for state employees just to keep these things in mind. I know I said this earlier, but if you're sick or you have symptoms, you really need to stay at home. It's just important to keep that in mind. That's a new way of thinking for us. So it's no longer right to go to work sick. Not that it was ever really right, but people just did that. That's not a good habit anymore. We have to change that right away. And the other thing is that if you're working in a state building, you have to wear a mask. I'm wearing a mask when I'm working. I'm not wearing a mask right now because I'm doing a video talking to you so you can hear me. You probably noticed this when you're wearing a mask. It's a little bit muffled with your speech, but I have my mask right over there, so it'll be okay. And then one of the things that's really important, we have to stop touching our hands, we have to stop touching our face, we have to wash our hands. You know, hand washing sounds boring, and I don't know that I can make hand washing sound interesting to you. You know what though, I wash my hands for 20 seconds, but I have to purposely count out the 20 seconds for me. And if I don't purposely do that, then I don't wash my hands for 20 seconds. And you know, a lot of us are busy, but if we're too busy to wash our hands for 20 seconds, can we just agree to get less busy and maybe enjoy life a little bit longer? I'm not saying hand washing has to be enjoyable, but we have to take time to do things that are important. And hand washing is one of those things that are important. And the other point is, we need to stay 6 feet away from each other. That's part of the new normal. You know, and that's different for us. We used to come up and greet each other. We might shake hands, we might hug in the morning. We don't do that anymore, right? We stay 6 feet away. We're still friendly with each other. We still socialize, but we have to keep that 6 feet distance. So there's a lot of information on the Department of Health website. If you go to the Department of Health website at www.health.ri.gov, there's a lot of fun information there for you, and you can learn about COVID-19. It's an authoritative website with a lot of good information. We keep it up to date multiple times throughout the day, and I want to thank you for watching my video today. I hope you have a great day. Bye-bye.